HCA 415 Community and Public Health. Ebola in West Africa. Brief background of the issue. Ebola has been traced from humans to primates to the most likely carrier, bats. Oshie et al. 2014 explains the main suspect host of the Ebola virus in bat flight and zoontic viruses emerging infectious diseases. Bats are sources of high viral diversity and high-profile zoontic viruses worldwide. Although apparently not pathogenic in their reservoir hosts, some viruses from bats severely affect other mammals, including humans. For example, severe acute respiratory syndrome, conoviruses, Ebola, and Marburg viruses. Paragraph 1. In some parts of Africa, bats are hunted and consumed for food. This is one way which Ebola began to infect populations. Once a bat infects a human, and highly contagious nature of the virus results in the spreading of the virus unless containment measures are put in place immediately. Ebola virus symptoms include, as listed by the World Health Organization 2014 in Ebola virus disease fact sheet: fever greater than 101.5 degrees Fahrenheit, severe headache, muscle pain, weakness, diarrhea, vomiting, abdominal pain, unexplained bleeding or bruising. Symptoms may appear anywhere from 2 to 21 days after exposure to Ebola. The World Health Organization reports 13,567 cases and 4,951 deaths from this virus linked back to the bats in West Africa. Thesis: Ebola is an infectious disease which has taken a heavy toll on the adult demographic in Guinea and throughout West Africa due to the ease with which Ebola spreads and the lack of protective precautions. Target population. Age. All Africa 2014 reported from a survey conducted by the National Ebola Task Force that those in the age range between 25 through 34 were the highest infected population. All Africa 2014 gives this account in West African women disproportionately affected by Ebola in regards to the gender population affected by Ebola. More than half of all Ebola cases in West Africa have been adult women. Paragraph 1. One of the reasons this may be is that women are often not appropriately protected as they care for those with Ebola. All Africa continues, women also need to be given better access to appropriate safety gear such as goggles, gloves, masks for use when caring for the sick. Paragraph 17. Culture, ethnicity, and location. From past outbreaks of Ebola, it seemed to affect African countries. However, during this current outbreak of Ebola, we have seen the virus attack not just in West Africa, but in the United States, as well as affecting individuals of different ethnicities and cultures. Ebola effect on Guinea. According to the World Health Organization's 2014 report, Ebola virus disease West Africa, comes this account of Ebola's handiwork. Morbidity report confirmed, 579 cases. Mortality report confirmed, 343 deaths. Ebola risk factor. According to McNeil 2014, in the article Ebola, Killing Scores in Guinea, Threatens Nearby Nations, the outbreak in Guinea is of the Zaire strain, which has a 90% mortality rate. Death is caused by fever and internal bleeding. Human outbreaks usually start off after hunters eat the carcasses of an ape that died of Ebola, possibly after eating fruit contaminated by bats, which are the virus's natural reservoir. But inhabitants of the affected villages in Guinea also eat bats, so it's possible for it to skip the apes and go straight from bats to people. Dr. Safir said, once humans are infected, the virus spreads easily in bodily fluids from the sick or the dead. Outbreaks are contained by isolating the ill and making sure that those treating them wear gloves, masks, goggles, hazardous material suits, and other barriers against infection. Medical teams also take over burials since some traditional practices like washing bodies by hand can lead to infection. Searching for the sick and educating the public about the danger are also crucial measures because some people panic and flee during the outbreak, and many carry the virus from town to town. Paragraph 5. Searching for the sick is an important part of controlling the spread of Ebola, as it spreads easily, the CDC 2014 reports in the Ebola Transmission Report. When infection does occur in humans, the virus can be spread in several ways to others. Ebola is spread through direct contact through broken skin or mucous membranes in, for example, the eyes, nose, or mouth, with blood or bodily fluids, including but not limited to urine, saliva, feces, vomit, breast milk, and semen. As a person who is sick with Ebola, objects like needles and syringes that have been contaminated with the virus infected fruit bats or primates, apes and monkeys. Paragraph 2. Demographic information by epidemiological assessment measures. Monitor health. This is a crucial step to controlling any infectious disease within a demographic. If the first cases are identified quickly, the threat may be contained. Ebola has been gaining momentum since 2007. Friss et al. 2013 reports and Community and Public Health outlines some of the Ebola's progressions. 2007 Ebola hemorrhagic fever outbreak in the Democratic Republic of Congo. 2007 hemorrhagic fever outbreak in Uganda caused by a new strain of Ebola, Baribagyo Ebola virus. 2008 Ebola-like outbreak in Zambia due to previously unknown virus, Luho hemorrhagic fever virus. Now Ebola is being very closely monitored to the extent of installing infection detectors at airports. All U.S. residents are urged by the CDC to avoid non-essential travel to Guinea, along with Liberia and Sierra Leone, because of this horrific Ebola outbreak. The CDC is encouraging all travelers to protect themselves by being very cautious while coming in contact with blood and bodily fluids from any person infected with the Ebola virus. The CDC's Division of Global Migration and Quarantine is working with airlines, airports, and ministries of health to provide technical assistance for the development of exit screening and travel restrictions in the affected areas. Diagnose and investigate. By investigating and diagnosing an outbreak, a response may be organized to contain the outbreak. Vaccines and antidotes may be supplied to healthcare facilities immediately. Ebola, action taken. The World Health Organization 2014 reports in regards to resources provided to Guinea. The World Health Organization supplies arrive in Guinea to support the Ebola outbreak response. More than 3.5 tons of protection material arrived in Conakry, the capital of Guinea, on March 30th. World Health Organization immediately started distributing it to the health facilities in different locations dealing with the outbreak of Ebola virus disease. The supplies include single-use personal protection equipment and disinfection and secure burial material. Half of the affected persons in a Conakry are health workers. Providing them with adequate training and necessary equipment is crucial for infection control. Paragraph 1. The CDC urges individuals to avoid non-essential travel to Guinea along with Liberia and Sierra Leone because of this horrific Ebola outbreak. The CDC is encouraging all travelers to protect themselves, to be very cautious while coming in contact with blood and bodily fluids and any persons infected with Ebola virus. The CDC Division of Global Migration and Quarantine is working with airlines, airports, and ministries of health to provide technical assistance for the development of exit screening and travel restrictions in the affected areas. These include presenting Ebola-affected countries the ability to conduct airport exit screening, assisting with development of exit screening protocols, training staff on exit screening protocols and appropriate PPE use, training in-country staff to provide future trainings. Ebola intervention in Guinea. The World Health Organization 2014 gives this account of action taken to control Ebola in Guinea and other infected countries in Ebola virus disease outbreak response plan in West Africa. All affected countries have established a national task force for Ebola outbreak response, and several governments have declared the Ebola virus disease epidemic as a national health emergency. The 3 countries that have organized a series of consultations to enable their national task force to develop a national Ebola outbreak response plan: the national government of Guinea, Liberia, and Sierra Leone shared their national strategic plans for accelerated response to the EBD outbreak. To help coordinate technical assistance and control this outbreak, the CDC has activated an Emergency Operations Center. West Africa region plans to send additional public health experts to the affected countries to expand current response activities. The CDC has instituted quarantine measures for communities heavily affected by Ebola. Travel in and out of these countries will be restricted. The CD staff have been working 24 hours, 7 days a week at over 20 border health fields, which include international airports and also land offices. As of October 27, 2014, the CDC Public Health Authorities began active post-arrival, which monitors health of travelers who originate in Guinea, as well as Liberia and Sierra Leone. Guinea intervened the sale of potential Ebola-affected bats, as BBC News Africa 2014 reports an Ebola Guinea outbreak reaches capital Conakry. In 2014, there was an outbreak of the Ebola virus in Guinea. In response, the health ministry banned the thought to be carriers of the disease. Despite this measure, the virus virtually spread from rural areas to Conakry. Paragraph 4. Ebola existing policies. The existing policies for Ebola and other infectious disease control include proper personal protective equipment, PPE, should be worn to protect from any exposure to the skin, blood, or bodily fluid in a hospital setting. The Ebola virus is classified as a Category A infectious substance by the regulation of the U.S. Department of Transportation's Hazardous Material Regulation. According to the CDC, any infectious substance transported must be packaged and transported in accordance with the HMR. No person may offer or accept a hazardous material for transportation in commerce unless that person is registered. This includes medical equipment, linens, and used healthcare products such as soiled absorbent pads or dressings, kidney-shaped emesis pans, portable toilets, used personal protection equipment, gloves, masks, gowns, goggles, face shields, respirators, booties, etc. by byproducts or cleanings. Contaminated or suspected of being contaminated. Also, various quarantine policies have been set for those suspected to have been exposed to Ebola. Ebola new policy development determined at the Accra meeting. If policy development could be improved in the area of health environment treating, Ebola may not have the opportunity to affect populations. Taking better precaution when coming in contact with infectious persons could have prevented some of the deaths. Wearing proper protective gear from head to toe and disposing of clothing, equipment, and tools. Many of these things are taking place, but it should always be about the safety and the well-being of yourself and the individuals. The World Health Organization 2014 reports measures being taken to further develop these policies, as well as set new policies in motion in Ebola virus disease outbreak response plan in West Africa. At the Accra meeting, the ministers agreed that the current situation poses a serious threat to all countries of the region and beyond, and called for immediate national leadership, enhanced cross-border collaboration, and community participation in the response. Many religious leaders and organizations were involved and stressed their opinions. In order for this to be successful, all parties need to act accordingly. The Accra meeting called on governments to mobilize relevant government sectors and community, religious, and political leaders to work together in improving awareness, socio-social support, and understanding of Ebola situation by communities in order to achieve more effective response. Convene national intersectoral meetings, involve key government ministries, national technical coordinating committee members, and stakeholders to develop a roadmap for immediate implementation of the strategy adopted at the meeting. Support additional domestic financial resources to support the outbreak response. Work and share experiences with other countries that have previously managed Ebola outbreaks. Improve information and communication to communities on matters related to the Ebola epidemic. Facilitators in Guinea's Ebola challenges include the following. Essential services of policy development: inform, educate, and empower. Being educated concerning the threat of Ebola can save the lives of many. Preventative care also must be taken very seriously when coming in contact with an infectious person, as Ebola spreads easily. Mobilize community partnerships, develop policies. References.